Hey Eric, it's Dr. Wong. We started your left knee scope. As you know, we do arthroscopy underwater, so you'll see fluid and bubbles flowing in and out of the joint. Just to get you oriented, this blue cannula is a 5.5 millimeters in diameter. The tip of this probe is about 3 millimeters, so this is very magnified. You can see everything very clearly on the TV monitor. Just get you focused real well. First things first, to get you oriented, we look around everywhere in the knee joint to make sure we examine everything. This is a suprapatellar pouch. It looks fine. That's like normal lining of your knee. Up top here is your kneecap or patella. I'm going to take pictures as we go along during the case just to show you a little bit of everything. That patella looks pretty clear to me. No evidence of arthritis. You do have a fair amount of synovitis or plica here on the left. That's this very red and inflamed tissue. So I'm going to take a picture of that showing you've got a fair amount of plica. Bend your knee down, look down at the trochlear groove. Make sure there's not a bunch of fraying on the trochlea, and there is not. We come around to the side, what we call the lateral gutter. If I'm able to make it all the way over, I'm not going to be able to, so we'll just go to the lateral gutter here, or lateral compartment. So we can put you in figure 4 position. Really pull up there. I'll look over here. Get the suction going. And there we go. You can see a lot of your synovitis is in the way. So let's see if we can get some of this tissue to flow out. There we go. We see a little bit of your meniscus. This is lateral meniscus. It looks nice and stable. No tears. Take a few pictures of this. Normal popliteal hiatus in the back. Here's the body of the meniscus, also not torn. No arthritis. Let's look up at the condyle as we flex and extend the knee. And no arthritis there. So let's bring it back down to the notch. And it looks like this synovitis is getting in the way, so I'm going to start shaving it out. It may ooze a little bit because that's very vascular. I'm just going to get inside this cannula. Hold the blue cannula a little bit more. It's pretty tight. Hold it a little bit more. Alright, it's just going to make it out a little bit. A pedal. It's not going. Yeah. Here, hold the scope for me. I'm just going to work this in.
You worked with that before you started the church.
There we go. All right, now we've got that going. Let's now reattach it. It's not going. That's the hand piece. So we're going to work on the foot pedal. But I'm working with a hand control right now. I'm just going to trim out some of the synovitis in the front of your knee, just so we can see everything a little bit more clearly. There we go. There's your ACL. Nice and tight. I remember on your MRI that there was some suggestion there may be a partial stress stretching out. That looks pretty nice and tight to me, so there's certainly nothing significant. Here's your PCL, running from the medial femoral condyle back behind the PCL. Okay. And we're going to work our way here into the back of your knee. Sometimes we'll be able to make it all the way back in. Just back here behind your PCL. There it is. I don't see any loose bodies back there. That's good. PCL looks nice and healthy, and that looks great. Now we're going to go over here to the medial compartment. That's where we see most of your problems on the MRI. You can see there's a little bit of fraying. No. I'll take a picture of that. That's some chondromalacia on your medial femoral condyle. I'm going to see if we can get this in and start to shave it a little bit. Just like that. Looks good. Let's let the knee down just a touch to get to this area right there. That's where the chondromalacia is the worst. So we'll trim this a little bit. This certainly in and of itself can cause some pain that you may be having. It's certainly not severe. This is maybe grade 1 to grade 2 chondromalacia. All that means is some mild cartilage damage. There's a 4-stage grading system. Grade 4 is basically bare bone, so that's severe arthritis. This is not. This is grade 1. Some areas of grade 2 right here, a little bit damaged. So that could be causing your pain. We're going to take a look at the back of your knee too, at the posterior horn, to see if the medial meniscus really is torn like it's shown on the MRI. Okay. Good. Let's get the blue cannula back and the trocar. All right, probe, please. All right, so now here I'm looking at the back of your knee in the medial compartment, and that's what's showing up on your MRI here. There's a little bit of a cleft, a radial tear right in here. Let me get it a little more focused, get some fluid suctioned out. So it's certainly nothing severe, but it is a radial tear that could be causing your meniscus to be a little bit looser. See, you notice it does pull into the joint. So all I'm going to have to do is trim this area. I'm not going to take it all the way back to the root because then that would destabilize your meniscus, but I'll just trim this part out right now with an up-biter, and then we'll be out of your knee. I think you'll feel a lot better. Okay. So I'll use these instruments. These are a little bit different from the shoulder instruments that you saw me do a few months ago, but nonetheless just as effective. So here's a little biter. You see that tear there. Let me just take a picture. I don't think I did yet. Yeah. So I'm going to trim this out right at the apex of that radial tear. Take some of this. I'm not going to take a bunch of this because this is relatively normal here. So just bevel it back to that tear so there's less of a stress riser. Yeah, right there. You see, just with a few bites of the basket, then I've beveled out that tear nicely. Yeah, it's just like that. And we'll get the suction going, and then we'll take out all this debris. And then I'll work with my shaver to basically debride the remainder of that tear. There we go. Okay. So then we got that going. It's a nice curved shaver, allows me to get underneath your condyle without damaging it. Unfortunately, you already had damage to it. It's possible that it could be from this meniscus tear. You never know if the meniscus tear causes the damage to the condyle or vice versa. Sometimes when patients get a lot of arthritis, their meniscus starts to degenerate and tear just because of the abnormal forces on the knee. In your case, this is both relatively mild, both the meniscus tear and the chondromalacia, so it's hard to know which one came first. But regardless, you've got pretty good reasons to be hurting along the medial side of the knee. Two good reasons to be hurting on the medial side of the knee. And since we're here, we're going to get rid of both these problems and get back to skiing soon. Okay, so this is pretty much it, Eric. I've beveled this back. That looks nice and stable. There's nothing loose anymore in the posterior horn. I'll just trim up the rest of this loose cartilage right here. But that, again, is relatively mild. Nothing severe, that is for sure. There we go. Let's get the probe back in, and I'll show you how this looks. So beveled back to that tear, the radial tear there. The root is still attached nicely. The rest of this meniscus looks fine. Let's just take a shot of this just to show you. Nice and stable. And a shot here of your chondromalacia in addition. Okay, Eric, that's it. You're going to do great. You can get up, start walking right away. We'll wash your knee out with a bunch of fluid, wrap it up, and get you on your way. Good luck. I'll give you a call tomorrow to just check up on you, and I think you'll be fine. Take care.